Okay, everyone, I hope you're having a great evening. I'm going to start off by introducing myself. My name is Samir Ghandour. I'm a medical student at the University of Lebanon. Tonight, I'm going to talk to you about cocaine, some insights and awareness about cocaine as an ambassador of Lamsa. So to begin with, what is cocaine? So cocaine is a very powerful stimulant that it could arguably be the prototype of stimulants. It's also one of those historical stimulants that has a deep history that we're going to touch on soon. In the United States, it's listed as a Schedule II drug, which means that cocaine is a highly addictive substance that could be, under certain circumstances and indications, used medically in order to treat some certain diseases. So cocaine is actually extracted from the coca plant that commonly grows in South America due to the perfect combination of weather and soil that allows this plant to grow. And it's shown here on the left side of the screen. The cocaine is actually extracted from the leaves of the plant, specifically the leaves of the plant. And it is also notable to mention that although the medical community has strayed away in the past few decades from using cocaine for treatments, very recently actually the FDA has approved a nasal spray that contains cocaine as a main ingredient for the treatment of nasal congestion and other nasal diseases. So what are the common names that are found on the streets for cocaine, referring to cocaine? These include mainly, and most importantly, coke and crack, and nose candy and snow, sometimes flake as well, and other names that are not as commonly used, mentioned here and listed here. So let's talk some history about cocaine. The native Peruvians were the pioneers of cocaine use. Mainly, the native Peruvians actually chewed on the coca leaves or ingested them in religious ceremonies, strictly in religious ceremonies, and it was actually considered a taboo to chew or ingest the coca leaves outside of religious ceremonies. However, this taboo was actually not followed anymore when the Spanish colonialists invaded and started colonizing South America. When the native Peruvians and other South Americans started ingesting or chewing the coca leaves in order to fuel their resistance and their fight against colonialism. Now, most notably and importantly, actually, the German chemist Albert Newman, shown here on the left side of the screen, was the first person to extract pure cocaine from the coca leaves in around 1859. And it took the medical community about 3 decades in the 1880s, 2 to 3 decades in the 1880s, when they started using it to block pain and as a local anesthetic for medical procedures. On the right side of the screen, I'm pretty sure most of us are familiar with that person. His name is Sigmund Freud, and he's an Austrian psychoanalyst, and he was the first person to actually prescribe cocaine for psychiatric illnesses such as depression and other mental diseases, and also he used to prescribe cocaine for sexual impotence as well. Now, it is important to mention that Sigmund Freud was actually addicted to cocaine. He used to use it very, very much, and he used to actually prescribe it to his colleagues, to his wife, and to his friends, who also used it excessively and became addicted to it. Later on in history, in around, I believe, around 1886, John Pemberton added coca leaves as one of the ingredients in Coca-Cola, but the company faced a lot of public pressure because of that, and in 1903 removed coca leaves from Coca-Cola. Later on, cocaine gained momentum in the public eye, and the cocaine use became very frequent. And in 1912, the United States actually recorded 5,000 cocaine-related deaths. And in 1922, the U.S. government legally and officially banned cocaine. So I'm pretty sure everyone is familiar with this figure, Pablo Escobar, who in 1976 founded the Medellin cartel. And he established smuggling routes into the United States and later on to Asia and Europe, mainly smuggling cocaine. And it was a turning point in cocaine's history because Prior to that, in the 50s and 60s, cocaine wasn't as abundant, especially in the States. And it was very hard to get cocaine, and it was only available to those who can pay a lot of money to it. So it was basically considered a rich man's drug. But after establishing the drug smuggling routes into the United States, cocaine became very readily available in the States, and it became very cheap and attainable to many people. And it was later on dubbed the poor man's drug in the 70s and 80s. So let's talk about some statistics. In Lebanon, the statistics aren't really great, as you can imagine. The latest statistics on cocaine were in 2003, which showed that people aged between the age of 18 and 44 had a prevalence rate of cocaine use of around 0.6%. And a national school survey in 2009 showed that school students between the age of 12 and 19, around 11% of them knew at least someone who used cocaine, which is a pretty significant number. In the United States, the numbers are a bit higher, obviously. In the United States, the rates of cocaine use remained relatively stable since 2009, and the numbers stayed at around 2.7%. 2.7% in people aged between 15 and 64. In the world, it's a bit difficult to find clear statistics on cocaine use because some countries do not collect information regarding cocaine use. But it's estimated that around 7,000 cocaine-related deaths occur every year worldwide. So there are mainly two main forms of cocaine. On the left side of the screen, this is the more common form of cocaine, and this is the form more people are more familiar with. And this is the water-soluble form, or the hydrochloric acid salt form. And on the right side of the screen, you can see a less common form, which is referred to as crack or freebase cocaine, which is the water-insoluble form. And these two forms basically have different methods of use, which we're going to touch on soon. So how is cocaine used? Now, as we've mentioned, the first form that we talked about, the salt form, or the hydrochloric acid salt form, could be snorted or injected. In this case, we can see a photo here of snorting it, and here we can see that people sometimes inject it, where they basically heat it in a solution in a spoon, and then they fill a syringe and they inject it directly into their veins. Now, the crack or the freebase form of cocaine is mainly smoked. And in this photo, it's smoked usually in a pipe, as the one shown here in this photo, where you light one side of the pipe, but it contains the freebase or crack cocaine, and it's smoked from the other side. Now, the mechanism of action of cocaine. Now, like many other stimulants, cocaine mainly acts on the neurons and the way they interact with each other. Now, neurons mainly, any two neurons basically interact by releasing neurotransmitters between them. This is how they interact, this is how they communicate. And they do that by releasing neurotransmitters in what we call the synaptic cleft here between two neurons. And in the case of cocaine, it acts on neurons that are rich in monoamine neurotransmitters. Monoamine neurotransmitters include dopamine, norepinephrine, and serotonin. Now, most notably, cocaine acts on neurons specifically, and its effects exerts its effects specifically on neurons that communicate via dopamine. So when cocaine is when it's used, cocaine actually binds to the reuptake transporters on the presynaptic cells, or the first neurons, and prevents the reuptake of dopamine from the synaptic cleft, preventing the inhibition of a signal when it's no longer needed. So when dopamine stays for longer in the synaptic cleft and accumulates and increases in concentration in the synaptic cleft, the signal continues to the second neuron, and this is how cocaine actually exerts its effects on a cellular level. Now, on a central nervous system level, it's important first to explain that we have two important pathways in the brain called the mesolimbic and the mesocortical pathways. And the mesolimbic and the mesocortical pathways are the two most important pathways affected by cocaine use. We have two areas called the ventral tegmental area, which is found in the brainstem, and the nucleus accumbens, which is found in the frontal cortex. Now, the ventral tegmental area contains a group of neurons that are rich in dopamine, and they send projections to a lot of areas of the brain, and most notably the frontal cortex and the limbic system, and what we call the mesolimbic and the mesocortical pathways. Now, when cocaine affects the mechanism, the dopamine release in these neurons, and prevents the reuptake of dopamine in those neurons, it causes increased stimulated effects on these pathways. Now, the mesolimbic pathway is mainly responsible for feelings, emotions, and impulses. And the mesocortical pathway is mostly important for our judgment, our behaviors, and if disrupted, can lead to violent behavior. Now, these informations are very important for later on when we discuss the long-term and the short-term effects of cocaine. Now, the short-term health effects of cocaine, mainly we look at things like narrowed blood vessels because of the increased sympathetic output to the rest of the body. We can see enlarged pupils, increased body temperature, heart rate, and blood pressure. Abdominal pain and nausea also related to the direct effects of cocaine on these organs. Euphoria due to the increased activity of the mesolimbic pathway that we previously mentioned, euphoria and pleasure. Increased energy and alertness, also related to the effects on the mesocortical and limbic pathways. And restlessness, anxiety, impulsivity, violent behavior, and psychosis, which are very important health effects that are also important when we talk about bloodborne diseases related to cocaine use later on. And one of the serious short health-term effects are acute heart failure, heart attacks, strokes, seizures, and even coma. Now, when it comes to long-term health effects, we have effects such as loss of sense of smell, because cocaine, especially if snorted or smoked, can affect directly the nasal mucosa and our olfactory receptors that are responsible for smell. Nosebleeds, because of how friable and fragile the blood vessels become in our nasal area, and which also leads to nasal damage, causing ulcers, gangrenes, septal and palatine perforations, as we can see in this photo, where we see a small perforation in the roof of the mouth that connects directly into the nasal cavity due to the weakness of the blood vessels that supply this area and causes the death of tissue in that area. We also see dental decay, not only because of the drug's effect on teeth itself, but also because people who consume cocaine tend to take less care of their oral hygiene. We can see difficulty swallowing, gastrointestinal ischemia, also related to the narrowing of the blood vessels that supply these organs. Poor nutrition and weight loss, not only because of the direct effects on the sensation of hunger in these people, but also because sometimes when people who are addicted to cocaine, especially those of low socioeconomic status and those who do not have the means to purchase food like other people, tend to funnel their finances into buying the drug itself because they're addicted to it. And would not actually buy food and therefore lose weight as well. Lung disorders, specifically in those who smoke and snort cocaine. Neurological decline, which is in two forms actually. We have functional neurological decline and structural changes in the brain that occur upon cocaine use. And it is important to mention that the structural changes in the brain occur more severely the earlier someone starts using cocaine. And it's also important to mention that people who use cocaine are at increased risk of acquiring HIV, hepatitis B, and hepatitis C. And these are bloodborne diseases, and the people who use cocaine are at increased risk, especially if they inject the drug, because people who inject cocaine tend to share needles and not replace their needles. And this increases the risk of acquiring a bloodborne disease. Not sure why it's not changing. Okay. So to illustrate more on the structural changes that occur in cocaine abuse, as we've mentioned, cocaine actually affects the neurons that are rich in dopamine and causes at the present increased or elevated levels of dopamine in these in the connections between those neurons. And on the left side, we see a scan of a brain of a non-drug user, and on the right we see a scan of a cocaine abuser. And this scan actually shows us the availability of dopamine receptors, or here they're referred to as D2 receptors. And in those who abuse cocaine or use cocaine on the long term, the brain tends to adapt to this increased presence of dopamine at its receptors by decreasing the levels of receptors in its neurons. And this causes structural changes in the brain and eventually leads to neurological deficits. And in this case, for example, this area that is highlighted here is called the striatum. And the striatum is a very important structure in our brain that is responsible for coordinating movements, for coordinating speech, and even for critical thinking. Now, one of the most important long-term health effects of cocaine use is on the cardiovascular system. And it mainly has two components. First of all, cocaine, as we know, narrows blood vessels because it increases the sympathetic tone, increases the sympathetic output from our central nervous system, and causes narrowing of our blood vessels. So when our blood vessels are narrowed abnormally, this causes narrowing of the blood vessels that feed the heart muscle. And on the other hand, the increased heart rate, the increased blood pressure that is sustained over a long period of time with long-term use of cocaine also increases strain on the heart muscle, which increases the risk of developing acute heart failure or chronic heart failure or strokes or heart attacks. And cardiovascular complications are considered the #1 cause of death in cocaine abusers. Now, when we talk about withdrawal of any drug, the signs and symptoms of withdrawal mainly are a mirror of the effects of the drug itself, meaning that the withdrawal signs and symptoms are usually the opposite of the signs and symptoms experienced when using the drug. And these withdrawal symptoms of cocaine usually include agitation and restless behavior, depressive mood, which is opposite to the euphoria experienced during cocaine use, fatigue, general feeling of discomfort, increased appetite, which is opposite to the poor nutrition and the weight loss experienced in long-term cocaine use, vivid and unpleasant dreams, slowing of activity, and even suicidal thoughts. And it's even, as we've mentioned before, the earlier someone uses cocaine, the more profound the effects and the more worse the withdrawal symptoms as someone who used it recently. Now, when it comes to the treatment of cocaine addiction, there are several behavioral therapies, most notably cognitive behavioral therapy, contingency management, in which patients are followed up and instructed and trained in order to change their behaviors regarding cocaine, the Matrix model, and the famous 12-step program. Unfortunately, there are no FDA-approved medical treatments for cocaine addiction. Now, when we talk about prevention of cocaine use and abuse, it is important to identify the populations who are at increased risk of using the drug. And most importantly, you should focus on age and earlier use, because these people who are aged between 18 and 25 are at the highest risk of using cocaine. Studies have shown that genetics play a major role in someone's susceptibility to become addicted to cocaine. Which means that, for example, if you have 10 people who are exposed to cocaine and use cocaine for the same amount of time and the same amount of doses, those who are genetically susceptible are more likely to be addicted to the drug. Socioeconomic status also plays an important role, as people of low socioeconomic status are more likely to be unemployed, are more likely to have less prospects in life, and are more inclined to use drugs and eventually become addicted to them. Environmental factors are also important, especially in children. The lack of parental involvement, peer pressure, and specific settings where the drug is readily available or it can be easily used without supervision are important risk factors. It is also important to note that cocaine use and even other drug abuse is people who are at increased risk of abusing a drug, specifically at periods of transition and extreme stress. For example, in adults, it could be a divorce, it could be a loss of a loved one. For children, it could be moving, changing schools, bullying, alienation, and so on and so forth. It's also always important to spread awareness in schools and communities. It is now, when it comes to people who have already been addicted to cocaine and who have successfully managed their addiction, it is important to avoid environmental cues that remind them of their cocaine use, because people who used to use cocaine are at increased risk of relapse, especially when they're around specific environmental cues, such as the site of cocaine itself or something that looks similar to it as well. The places where they used to inject, smoke, or snort cocaine, or even being around people who they used to snort or smoke or inject cocaine. Now, needle exchange programs aren't necessarily important or significant in preventing the use of cocaine, but they're important in preventing bloodborne diseases that are associated with cocaine use, and specifically injection use. Now, in the United States and some countries in Europe, they actually instated needle exchange programs started doing that around 10 years ago. And the programs actually showed very promising results in decreasing the rates of transmission of HIV, hepatitis B, and hepatitis C amongst cocaine abusers. Thank you very much. I hope this was a good, brief, and educational webinar on cocaine abuse. I'm going to stick around for a couple of minutes in case you have any questions. Feel free to use your mic or even type the questions in the chat.